Okay, so um, I'm going to do a presentation about preventing early childhood caries. So I'm doing this on behalf of my group with Ivania and Rafael. And with us today we have Lindsay. She owns her own daycare. If you could just tell a little bit about yourself, Lindsay, if you'd like. Perfect, awesome, thank you. Okay, so now we're gonna go ahead and start. So the table of contents. So I'm going to be talking about what are early childhood caries. So we refer to them as ECC. The possible causes, signs and symptoms, strategies to decrease ECC. I'm going to show you some brushing techniques, how to engage children in oral hygiene care, the importance of dental hygiene care, and at the end, if you have any questions, just please ask away. So early childhood caries. So these are any caries in a primary dentition in children under the age of 6. Um, so this is the most common childhood disease. According to the CDA, the College of Dental Dentists in Canada, the Canadian Dental Association, sorry, the prevalence of ECC in Canadian preschool children is a growing concern. So dental surgery for ECC under general anesthesia is the most common day surgery procedure at most pediatric hospitals in Canada. So that's pretty concerning. It's an infectious, transmissible, and diet-dependent disease, but it is preventable. So it has lasting detrimental impact on both primary and permanent teeth. So ECC can contribute to adverse health effects, including altered chewing, eating and sleeping patterns due to pain, potential growth restrictions, speech difficulties, low self-esteem, and poor bite. So as you see in the picture here, so the top pictures is a pretty normal, healthy primary teeth. So they're nice and white is what we like to see. The second pictures show some chalky white spots, which is a start of cavities. The third picture down there shows some brown spots on the teeth. And then the bottom ones is pretty severe decay cavities. So some possible causes. So nutrition. So when a child eats or drinks sugars, the germs in a child's mouth mix with sugars to make a mild acid. So this acid attacks the hard outer layer of the teeth, called enamel, and this can cause cavities. So we like to limit sugars and refined carbs, such as bread, crackers, teething biscuits, but that are made of white flour. Um, and so we also look at labels for when you buy foods for kids, like dextrose, fructose, glucose, that's all sugar. So we like to avoid gum with sugar, suckers like lollipops for kids, sticky sweets that stick to their teeth. So instead, we like to encourage good snacks, like vegetables, fruits, carrot sticks, cheese. And then also water is the best drink to have in between meals for kids, just to wash away whatever stuck to their teeth. And of course, poor oral hygiene also includes like no brushing, poor brushing techniques is a cause as well. Bottle feeding. Um, So this is important because of decreased saliva flow during sleep and an opportunity for disease causing bacteria to grow. So water would be okay for the baby to have in a bottle for overnight, but we like to not have the babies fall asleep with a bottle containing any formula, milk, or fruit juice. So this allows the liquid to pool in the baby's mouth on the teeth. So as you see in the picture, that causes for the upper teeth to have decay, start cavities. Let me see. So here is just a picture that's kind of explaining like how cavities really start. So first with sugars, we feed them bacteria that turns into acid mixed in the mouth. So then it damages the tooth surface, and over time this can cause a hole like a cavity. So passing harmful bacteria to the mouth. So a lot of people, many parents are unaware that when they kiss their child, they can pass harmful bacteria to the child from their mouth. to their baby's mouth, so putting their child at an increased risk for cavities. So bacteria is mostly commonly transferred through saliva when sharing, eating utensils, blowing on food, pre-chewing baby's food, licking a baby's pacifier to clean it, and kissing baby on the mouth. So this is also maybe something that you can inform parents with for you as working in a daycare, because a lot of people don't know this. Like even me before starting hygiene, I wasn't aware of that either. But yeah, that's a pretty common thing too that happens. Yeah. So some other signs and symptoms. So like I said earlier with the other pictures, or here's some similar pictures. So white spot lesions, brown spots, if the child has pain, swelling, eating difficulties, sleeping difficulties, if they're touching their mouth or their teeth, is an indicator that there could be a possible cavity starting. So possible consequences. So acute and a chronic pain, interference with a child's eating. So children with ECC are at risk of weighing less than 80% of their ideal weight. Sleeping and proper growth, and normal growth and development may also be delayed due to pain and sleep disturbances. Some tooth loss and malocclusion, which is our biting problems. So as seen as the bottom picture to your right. Caries in the primary dentition has been indicated as a risk factor for future dental caries in the primary permanent dentition. So if they have early cavities, this can also affect their permanent teeth when they come in. They have an increased expenses for dental care throughout life, and it compromises of general health. Young children often lack the ability to cooperate with dental procedures as well because of having a lot of cavities when they're younger. They tend to get scared of dental procedures in the future. Some strategies to decrease incidence of ECC. So fluoridated water. Put babies to bed with a bottle containing only water if they need it. It's also important to start to wean children from the bottle at 12 to 14 months. So encourage drinking from a cup between 6 to 12 months of age to start with that. And then drinking from a cup is less likely to cause liquid to collect and like pool on the teeth like a bottle does. Give babies a clean pacifier, so not dipped in honey or sugar, and do not clean up the pacifier in your own mouth. Clean the child's gums, teeth after feeding. Schedule regular appointments and good nutrition, and limit sugar intake. I'm just going to show you two videos. So here's a little brushing technique. It's called the phones technique that we use for children. Just going to make sure that you can hear it. Can you hear it okay? Okay. Perfect. So then here's a video of some flossing. Oops, there we go. Okay, so I'm gonna, oh, sorry. Now these videos keep playing. Oh, there we go. So how to engage a child in oral hygiene care. So I looked up a couple things. So it's nice for like for something that you could do in a daycare is like make have drawings for the kids, play some games of like eat this, not that, by printing off like pictures of bad snacks versus healthy snacks. So we want to eat the healthy snacks, not the sugars. Make like a tooth wand, like with crafts and stuff like that. Tell them about the tooth fairy. And then also it's really encouraged to brush and floss with the kids. Um, Kids tend to like reenact their parents. So like when you brush at home with your child, like when they see you brushing their teeth, they want to brush their teeth. Um, so it helps to like show them videos and just like interact with them that way. And just yeah, explain to them what it's so important to do. And even the tooth fairy really seems to help too. Kids like that and they get money or they put like their teeth, right, a tooth under their pillows. And yeah, like that really seems to help. And that's what we do in office too. We really try to engage the kids with little games and like, let's see. Sorry, I'm gonna go and move on to the next one. So just a quick review. Some risk factors of ECC are, so like I said, sleeping with a bottle containing milk, formula, or sweet juices, frequent snacks, a lot of sugar, when parents or caregivers do not brush a child's teeth or not with them, siblings and our parents that have cavities, and you can pass them on by kissing them, sharing utensils, or cleaning the pacifier in your mouth, and drinks with low fluoride water. So what you can do is increase like fluoride water, limit sugar intake and healthy snacks, clean a pacifier like under the tap, like just not with your mouth, clean the gums and teeth after feedings. So this also includes with infants. So your youngest child, I think, was under 2. So they obviously have teeth. But even with infants too, like after a bottle, we like to clean their gums even if there's no teeth, just with like a soft washcloth, like wet, just to kind of clean around their gums. Um, Brushing and flossing videos for the kids just to engage them with that, but also to inform parents or caregivers when a child shows any signs of symptoms. Like it'd be nice and important for you to share that with inform the parents so that they can seek action for that. Um, so here are just some references that that we all use to make this presentation, and that's the end of it. Do you have any questions or concerns, Lindsay? Or yeah. I know. That's pretty, yeah, there's a lot of like, even for myself too, like before we started hygiene, like it was shocking to me too. I did not know that. Yeah, yeah, it is. Um, well, that's great. I'm just gonna pause this.